Good morning and welcome to today's dental assistant session. Once I am done paying my debt to the Stratford Career Institute, then I will have my dental assistant diploma as well as other certificates I've collected and earned through Coursera, Allison, and Udemy. Procedure 24-1, electronic pulp testing, equipment and supplies, basic setup, mouth mirror, explorer, and cotton pliers. Electronic pulp tester, conducting medium such as toothpaste. Procedure steps, follow these steps to electronically test the pulp. Test control tooth first. Place a small amount of toothpaste on the tip of the electrode. The toothpaste acts as a conducting medium. Dry the tooth before using the electrode. Ask the patient to signal when he or she notices a sensation, which is usually a tingling or hot feeling. Place the tip on the facial surface of the tooth and gradually increase the power. Caution, do not place the electrode on a metal restoration, a wet surface, gingiva, or artificial crowns. If the patient feels any sensation, some degree of tooth vitality is indicated. If no sensation is felt, the pulp may be necrotic. Caries removal. The removal of dental caries is necessary in some patients to evaluate the pulp condition. If the patient has no symptoms but the radiograph shows deep caries and the tooth respond positively to other tests, caries removal will further determine pulp status. The dentist uses the dental hand piece to remove the decay and to determine whether there is reversible or irreversible or irrevocable pulpitis. Depending on the prognosis for the tooth, the endodontist would place a temporary or permanent restoration. Treatment plan. Once all the information has been gathered and the dentist has made a diagnosis for root canal therapy, the patient is informed of the necessary treatment. The patient must sign a consent form and make appointment and financial arrangements before treatment begins. To minimize anxiety and answer questions about the upcoming procedure, endodontic pamphlets or videos may be provided. Endodontic instrument. Procedure performed in endodontic treatment may require the use of specialized instruments. The purpose of these instruments is for debridement, which is removal of diseased and necrotic tissue from the canal. The instrument then shape and smooth the canal. Once the canal is free of bacteria and debris and the walls are smooth, a filling material can be placed. The dental assistant working in an endodontic office should be familiar with the various instruments used for endodontic treatment. Characteristics of intracanal instruments. Endodontic intracanal instruments are made of stainless steel and nickel titanium alloy wire. They are flexible, fracture resistant, smooth, able to maintain sharp cutting edge, and corrosion resistant. The wire is twisted and tapered into instruments called files and reamers. To ensure consistency in the size and length of intracanal instrument, the ADA and the manufacturer have standardized a number and color code system. Intracanal instruments have precise diameters and length that are consistent from manufacturer to manufacturer. Intracanal instruments range in size from 0.8 to 140 and in length from 21 to 25 mm. Barbed brooches. A barbed brooch is made of fine metal wire with tiny, sharp projection or barbs along the instrument shaft. The barbs are angled to a smooth entry but to catch tissue when retracted. Brooches are used to remove soft tissue from the pulp canal to extirpate the canal. The dentist select a brooch that is large enough to remove pulpal tissue but small enough so that it will not bind in the canal. Barbed brooch are supplied in various diameter ranging from XXX fine to coarse. The handle are metal or plastic and are color-coded. File. Endodontic files are used to enlarge and smooth the canal. They are long, tapered, twisted instruments that are moved up and down inside the canal and are available in various diameter and type. The handle of the endodontic file are color code according to standardized measurements. For example, a size -15 file is color code white and a 20 is color code yellow. Standard file are known as K-type files. These tightly twisted files are used to scrape and widen the walls of the canal and to remove necrotic tissue. The K-type file is rotated in the canal and then removed from the canal. A headstone file is manufactured by a different process than the K-type files. They are shaped like pine trees and resemble stacks of cones. The edge of headstone file are very sharp and cut aggressively. These files are only used in a push and pull motion. They are not rotated like K-type files because they will bind in the canal due to their design. Another group of file is available from many manufacturers, flex file. Flex file are made of stainless steel or nickel titanium and are crafted for an optimal balance of flexibility, strength, and sharpness. Used for curved and narrow canals requiring flexibility to negotiate, flex file come in various sizes and in both the 21 and the 25 mm length. Reamer. A reamer is used with a reaming or twisting motion. Like the file, they have long twisted shanks, but their blade are spaced much farther apart. The cutting action is complete as the reamer is revolved out of the canal. They are color code and numbered according to size, similar to the file. Reamers are not used as frequently as files. Rotary intracanal instrument. There are also broaches, files, and reamers available for use with an endodontic handpiece. These are called a rotary or engine broach, file, and reamer. These instruments have a notched end that attaches to a low-speed handpiece that is specifically designed for use in endodontic procedure. The rotary intracanal instrument are numbered and color code just like manual instrument. Endodontic organizer. Various methods are available to store and organize reamers and files. Some storage containers can be sterilized and are designed to hold a range of intracanal instruments. Large organizers often have built-in measuring gauge for setting stock. Finger ring are much smaller, holding only a few instruments at once. They come with disposable styrofoam pad. Rubber stop. A rubber stop, also called a file stop, endo stop, or marker, is placed on reamers and files to mark the length of the root canal and prevent perforation at the apex of the tooth during treatment. These small circular silicone discs have pre-punched holes in the center for easily application. The length is determined by holding a file with a rubber stop against a radiograph and adjusting the stop to match the incisal or cusp edge. The marked file is then measured on a small millimeter gauge. This number is recorded for reference and for marking other intracanal instruments. Gate Glidden drill. Gate Glidden drill are used with latch attachment on low-speed handpiece. These drills run in a clockwise direction, are long-shanked and elliptically shaped with blunt, football-shaped end, and they are supplied in 6 sizes marked near the notch of the shank. For example, a number 1 drill has 1 stripe and a number 6 has 6 stripe. The number 1 is equal to a size 50K type file, with each consecutive size increasing in diameter. Gate Glidden drill are used in the upper portion of the canal to prepare access to the opening by removing obstructing dentin. Piso reamer. Piso reamers have parallel cutting side rather than the elliptical shape of the Gate Glidden drill. They are used with latch attachment on low-speed handpiece. Piso reamers are supplied in various sizes, beginning at 0.70 millimeter for number 1 and increasing 0.20 millimeter for every subsequent size, ending at number 6. The handle are striped to indicate corresponding size. These instruments are supplied with or without safe tip. Piso reamer are used to prepare the canal for a post and to reduce the curvature of the canal orifice for straight line across. Lentulo spirals. The Lentulo spiral is a long twist, very flexible wire instrument used to spin root canal sealer or cement into the canal. The spirals are used with low-speed handpiece and a latch attachment.